Knock, knock. Can I come in?
Yes.
Hi, my name is Geneviève. I will be your nurse today. I will be performing, doing assessment on you. I'll be doing the peripheral, vascular, and along with the musculoskeletal assessment on you. Are you okay for that?
Yes.
Okay. Before coming in this room, I already washed my hand. I'll provide some privacy, and before we start, I will ask you some questions. Huh? But first of all, can you tell me what is your name?
Alan.
Okay, that's good. And then I'm gonna be asking you some questions, okay? So, have you experienced like any problem like with your skin, like change of color?
No.
How about like tingling, numbness?
No. No problems.
No problem?
No.
Okay. So then I'll start expecting, okay? I will be expecting for the characteristic of your. I'm going to be doing that bilaterally for the head, for like the top, the upper, the extremity, and the lower extremity, okay? So I'm expecting uh, the constitution mm, of your hair, your skin. So I'm looking for any like discoloration, because the normal skin color for mm, most of the people is pink, but the darker, those that have darker pigmentation, it can be pink or red, okay? So I'm looking for the discoloration, nothing, for rashes, for bruise, for lesion, for any mass, any swelling. There's nothing like that, so that's fine. I'm going to be looking now for the distribution of the hair, okay? So I will do that also laterally, so I can tell the hair is well distributed, is even, so, and is appropriate with the ethnicity. Now I'm going to be inspecting for your capillary refill. So what I'm going to do, I'm going to press on your nails, okay, and see when I let it go if the color will go back to the initial, which is pink. It's very good. And also I'm going to look for the shape, okay, the shape of your head. If is there any wrangling, no, there's nothing like that, which is good. So now I'm going to be looking for any edema, if you have edema, because if you have edema I can see it from here on your legs. So I don't see anything like that, which is very good. So now I will be palpating your pulse, okay? So I will start palpating. I will hold your hand like this, and I will be, can you lift your hand for me? Are you okay? Are you any pain?
No.
No pain, thank you. So I will trust, I will hold it like this for me, or I'm going to hold it like this. So I'm going to start with your, hold on, your radial one, okay? So I'm going to be palpating your radial pulse for a minute. So it should be between 60 and 100 because these are the normal beat per minute. Okay, so I will palpate for the pulse, the radial pulse. Okay, you have 85 beat per minute, which is in a normal range. Okay, so again, now I'm gonna hold it like this and I will palpate for the brachial one. Okay, so I'm gonna be pressing here, so hold it for me. So good, yeah, I got it. Good. Sometimes it's very difficult to get the brachial one, but I get it just fine. Good. Your brachial one is 89, which is normal, and it's very strong, which is good too. So it's there, it's present, you can feel it. Because sometimes is some people that are very sick, you don't feel the brachial, either the radial one. But I feel yours and they are very, very strong, which is very good. Okay? So now I'm gonna check for any I'm gonna palpate and see. I'm gonna check for the skin toggle, okay? Because we always check for the skin toggle to see if the patient is dehydrated, okay? Because being dehydrated is very bad. It can cause you a lot of, like, it can trigger it can trigger your fluid electrolyte, okay? So you can be dehydrated. So it's always good for us to check for, to palpate for the skin toggle. What I'm gonna do, hold your hand like this, I'm gonna pinch your skin and let it go. Good. Your skin went back to the normal, the initial where it was before. So because for the patient that are dehydrated, it doesn't go back like that. So it's good. Your skin toggle is good. And now what I'm gonna do, I'm gonna go ahead and check and palpate you for the temperature. Okay, I'm gonna do that here. Oh, good. Your skin is very warm, which is good. It's not cold. And also, I'm gonna do that here too. Okay, on your legs. Down there. Good. So your skin is very warm, and which is good. And I did it bilaterally. Okay. So now I'm gonna check again for any edema. So can you lift your foot for me, because I would like my camera to see it. Can you do that? Good. There's no edema. How about the other one, please? Are you okay?
Yeah.
Good. Good. Okay, there's no edema, because when you have edema, that means there's fluid that are stuck in your extremity, and it's not good. It can cause you a lot of problem too. Okay, the heart can be, you can have tachycardia, because the fluid doesn't go back. It goes, sometimes it goes just back to the lungs. Okay, so, and edema is not good, but you don't have any edema, which is very good. Now what I'm gonna do, I'm gonna palpate two more pulses. Okay, one gonna be the dorsipteris, and the other one gonna be the posterior one. Okay, can you lift your foot for me? So I'm gonna posterior tibia, this is the one. I palpate it for 1 minute too. Okay, oh, I can feel it. It's really beating very hard, so which is good. Okay, 75. which is in a normal range, because the pulse, as I told you, is the normal range is from 60 to 100. Okay, now I'm going to do the dorsipedis one. I'm going to remove your shoes for a minute. Okay, so hold it up so that the camera can see. So I will palpate that one here, the dorsipedis one. Okay, 78, which is good and it's very strong. It's present. I can feel it. So it's in the normal range too. Okay, so now I'm done with the peripheral vascular assessment. Okay, so I'm gonna go ahead and do your musculoskeletal skeletal one. Okay, which is just exercise. It's range of motion, just to make sure that your muscle are strong. Okay, just to make sure that there's no weakness anywhere. Do you have any problem walking this time?
No.
Do you have any muscle pain?
No.
Do you have any problem like moving around?
No.
No. Okay, so we're gonna go ahead and I'm gonna do help you exercising, but what I'm gonna do is gonna be a passive range of motion. Okay, so I'm gonna have you lay down in that bed. Okay, and can you do that for me? And while you're doing that, I'm gonna wash my hand again. Okay, so I'm gonna wash my hand again for at least 20 seconds, which I'm doing now, and I will reposition my camera so that I can see the patient lay on the bed. So Alan, can you go and you lay on the bed for me, please? And I will just fix the light to be able to see you. I'm trying to fix stuff here so that the patient can lay on the bed, so that the camera can see us. Okay, so hold on, let me just fix the camera again. Okay, so we will start now. Let me make sure that my camera is fine. Okay, and then can you go up a little bit, Alan? Because can you go up a little bit? Good, Alan. So now I know they don't see your head.
That's why I had it.
Can you go down? A little down. Yes, here. Put your head on the pillow. A little more. Because I just want to make sure that they can see you. So the more you're going up, they cannot see you. Okay, that's okay. It's fine. As long as they see what I'm doing, I think it's okay. So, Alan, we're gonna do some exercise just to help you with your muscle, okay? So you don't get weak. So first of all, I'm gonna put the bed higher, so on my where it can be on my sides right here. Okay, so I don't have to bend and hurt myself. So, and then put the side rail on both sides to prevent incident. It's not good, it's just for this, and then I will release them. Okay, so I'm going to start exercising your shoulder. Okay, we're going to start with the shoulder. What I'm going to do now with your shoulder is that I'm going to help you doing extension and flexion, okay, of your shoulder. Okay, so go ahead and do that for me. Now I'm going to help you. So go extension, flexion, extension, flexion, extension, flexion. Okay, so then I'm going to do the abduction, and then we also can do the hyperextension. Just push it back away, okay? So now we're going to do the adduction and abduction, okay? So go ahead and do it. I want to make sure that my camera can see me very good. Adduction, abduction, okay? Adduction, abduction, okay? We do that 3 times. Usually it's 5 times according to the care plan, but today we're going to do it 3 times, okay? This is adduction and then I'm going to do the inner rotation and out rotation. So inner rotation, out rotation, inner rotation, out rotation, inner rotation, out rotation. Now I'm going to go and do your elbow, okay? This is your elbow. So let's do, what is this? Extension, flexion, extension, flexion, extension, flexion, extension, flexion. And then we're going to do in rotation, out rotation, in rotation, out rotation. Good. We're done with the elbow. Now I'm going to go down to the waist. I want to make sure the camera can really see me, okay? So I'm going to go down to the waist. So we're going to do supine, dorsal, supine, dorsal, supine, dorsal, supine, dorsal, okay? Now we'll go ahead and do radial flexion and radial flexion and ulnar flexion, radial flexion and ulnar flexion, radial flexion and ulnar flexion. This is for the waist. So then we done. This is for the waist, okay? So go ahead now. Can you? Because after that I'm gonna go to the finger, okay? So can you? I'm gonna help you. Flexion, extension, flexion, extension, flexion, extension, flexion, extension. Now I'm going to do adduction and abduction. I'll do one by one, okay? I'll start with the thumb. So can you lift it for me so that the professor see it? This is adduction, abduction, adduction, abduction. I do one by one. Abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, 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 adduction, abduction, adduction. And then we're going to do the finger flexion. So here, hold me. Finger, put your finger. Flexion, extension, flexion. Sorry, are you okay?
Yes.
Extension, flexion, extension, flexion, extension. Now I'm going to do the opposition, okay? Like this. Both finger, this one and the big one, the big toe, and this one. Opposition, 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 opposition. But when I have to come here, let do, because I don't think I'm going to do supination and pronation, pronation, supination, pronation, supination, pronation, supination. You okay?
Yeah.
Good. Now we're going to go down to the leg. So I'll start with the hip, okay? So we're going to do your hip. Your hip, and can you go up so that the camera can see your leg? Can you go up, please? Yes, now I'm up so the camera is going to see your leg, okay? And see me too. I'm so sorry. I hope we are only 2 of us. There's nobody to hold the camera for us. So we're going to go with extension. I'm working on your hip, okay? Now extension, flexion, extension, flexion, extension, flexion, extension, flexion. So we're going to do now abduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction. And then we're going to do inner rotation. Inner rotation, I'm just going to do like this. Inner rotation, out rotation, inner rotation, out rotation, inner rotation, out rotation. Now I'm going to exercise your knee. Okay, so let's start it. Let's start. What is this? Flexion, extension, flexion, extension, flexion, extension, flexion, extension. And then we're going to do inner rotation, out rotation, inner rotation, out rotation, inner rotation, out rotation, inner like inside, okay, out rotation, out. So now we're going to go down. Can you go up more so that they can see my your ankle? Good. So we're going to go now to the ankle, okay? So I'll move my camera because I want to make sure that the professor can see me. Okay, good. So I'm going to exercise your ankle. Okay? So let go. Let go. No. Is plantiflexion, dorsiflexion. Plantiflexion, dorsiflexion. Plexiflexion, dorsiflexion. Plantiflexion, dorsiflexion. Okay? So, and then I'm going to go do here, so flexion, extension, flexion, extension, flexion, extension, flexion, extension. And I'm going to take one toe after the other one. So I will do adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. So the ankle, I did the abduction, adduction, flexion. Okay, now we're done with your exercise, and I'm going to do the other one bilaterally. Okay,
Yeah.
so I was supposed to, I'm doing the other, I'm going to do the other one bilaterally. Okay,
Yeah.
so since the time you have only 10 minutes, so I assume I did that the same way I did this one. So now we're done, Alan, and thank you so much for being patient. Okay, I'm just going to lower the bed again to the position that will make you safe. Okay, and then I'm going to lower my side rail too, because we're done with the exercise. Okay, and then go ahead. Are you okay?
Yeah.
I put the call light on your wrist so that if you want to call somebody, you can call. Okay, do you need anything?
No, just water.
Okay, I'll give you water. This is the water for you.
Thank you.
Okay, are you in a comfortable position?
Yes.
Good. I'm going to cover you back, and then I'll open the window. If you need something, just call. Okay, thank you for everything. I'll go ahead and wash my hand. Thank you.